Good afternoon once again. Today is the 27th of January, Wednesday, 2021, and this is the English language summary of the daily press briefing here at the Center for COVID Situation Administration, or CCSA, as always. So just to start off first by recapping some important salient points that was delivered by the spokesperson, Dr. Tawisin, just now. Basically, today we had the daily sub-CCSA committee meeting convened to deliberate on the further relaxation of measures in various provinces, particularly those provinces with a decreasing trend, decreasing cases of local transmission. And this meeting today and the one yesterday will be proposing to the general CCSA meeting, the big CCSA meeting, chaired by the Prime Minister this coming Friday to make the final decision. So some of the proposals that will be submitted to the big CCSA meeting, the big CCSA meeting will give the final decision, which may differ from the proposal actually, because we're still in the process of analyzing and coming out with the most appropriate relaxation measures, the degree and the area, and in each particular province as well, because these indeed are very important decisions which may affect the general public in various provinces. So we have to be very, very careful in this. There might be a proposal, but the final decision for Friday. These proposals might include the extension of opening hours of restaurants, perhaps until 2300 hours, the reopening of schools, the staggered time or hybrid learning types in schools in various provinces. Provinces with decreasing cases may be able to relax restriction measures according to the situation in each district as well. So we're looking at the district level situation as well. The criteria in determining the high or lower risk provinces and districts will also possibly include statistics. For example, if there had been any or no new cases, no new local transmissions in the past 7 days, or in the past 14 days, or in the past 28 days. So these kind of numbers will will be part of our proposal and criteria. Also, we'll be updating the list of controlled, highly controlled areas, provinces, controlled areas, maximum controlled, and all the like, all the other color schemes, the levels that you have seen on the maps shown. Basically, that is just the current classification, and we'll be probably updating that list according to the current situation. That being said, most provinces are moving down the scale in a good way, becoming less risky. There are certain points for highly controlled areas where some measures might not be the same as in the less risky provinces. I mentioned schools, alternate days, times, physical distancing, online teaching in parallel with actual face-to-face teaching. I mentioned that. Malls, limited activities, gambling places to remain closed in all areas. That will be part of perhaps the proposal. Gambling places to remain closed in all areas. So this afternoon, the Health Ministry will be submitting this proposal to the CCSA authorities, and the measures will be considered down to the district level, and final decision to be made on Friday at the general CCSA meeting. General situation, number of cases that we have recorded for today. And just to mention first that, like I said yesterday, the high numbers would be mostly from the active case findings. So please don't be alarmed of the high numbers that we had for yesterday and today. For today we have recorded new confirmed cases 819, of which 716 cases are from active case finding. So intentionally rooting out the positive cases in particular areas, including in Samut Sakhon. So 100 plus would not be in that group from this number, but most of them, around 700 plus, are from active case finding, making the total cumulative number of cases in Thailand since last year over 15,000. We have over 11,000 recoveries now. And minus the fatalities, of course, we have active cases still under treatment as 4,335. So on social media, I saw someone ask about the number of active cases being treated. How are they being treated? Of course, many cases are asymptomatic, and the proper treatment, meaning their entry into the medical treatment system, whatever is necessary in terms of the medicines they receive or the care, or even the monitoring of asymptomatic cases. So if it's asymptomatic, of course, the treatment would be different from those who have symptomatic symptoms. And of course, the treatment would be according to the standards that we have in our health system. So one additional fatality to report, unfortunately, it's with great sorrow that we have one more additional fatality to be reported for today, making the cumulative number of fatalities now standing at 76. The 76th fatality in Thailand is a 56-year-old Thai national male in Samut Sakhon province who had been suffering from ischemic stroke. And our condolences goes out to the family of the deceased. Just some observations from the presentation of the spokesperson, that in the past 2 days, there has been a sharp increase in the daily cases confirmed in Samut Sakhon from around 150 to around 900. So as mentioned, this is an expected scenario, since there had been an accelerated active case finding missions. These missions continuously conducted by the CCSA in order to break the chain of transmission in the area as soon as possible. So the key word is expected scenario. Most of these confirmed cases are asymptomatic, patients who do not require actual treatment in the same way that those who are symptomatic require. So therefore, once confirmed positive, these asymptomatic persons are taken to state quarantine facilities, which could help keep the hospitals from being too overcrowded for those with symptoms. So just to provide more explanation on this matter, just to elaborate on the work plan of the CCSA in Samut Sakhon, this is also to respond to a question on the spike of the number of cases that we have seen in the past 2 days. So the CCSA has begun its 3-week active case finding missions in Samut Sakhon since a few days ago, the 25th of January. And in the first week of this accelerated active case finding mission, which would be approximately the 25th to the 31st of January, the first week of this, we'll have intensive case finding in various areas. In the second week of our accelerated program for active case finding, which is the 1st to the 7th of February, the second week or the first week of the second week of the acceleration, or the first week of February, there will be follow-up cases with more details of how we have been able to find these active cases in local communities. And it is expected that in the many high-risk level 1 red zone districts, they could possibly be changed into a lower risk district, or level 2, or yellow colored districts. And from yellow districts, possibly some can be changed into the low risk level 3 or green districts. And in the third week of our accelerated active case finding program, the third week, which is the 8th to the 15th of February, the number of infections hopefully may decrease further because of this active case finding that had been going on. If there is a lower number of cases, particularly lower local transmission, measures will be relaxed further according to the proposal that will be proposed this week to the General CCSA meeting. So just some additional points towards the end of this briefing of mine, that the WHO, World Health Organization recommendation on contact tracing. That while active cases finding is useful in identifying infected case, contact tracing, this is confirmed by the World Health Organization, can break the chain of transmission. And you see an infographic there credited to the World Health Organization. You might be asked who you have seen or been in touch with, where you have been recently. Sharing these details helps the health authorities identify people who might be at risk of COVID-19 and keep people around you protected. So this is actually the principle, the way that we're going, the procedures, the measures that Thailand is implementing for contact tracing. And many countries, I believe, are also doing this. And as you can see, it's something that is actually recommended by the World Health Organization. So as such, it's possible to isolate people with COVID to prevent further spread and inform people who might be exposed and take them directly into the state quarantine system, which, of course, as you know, in Thailand, we have had the quarantine system since the very beginning, since the beginning of last year, since the wave last year. And I believe that this system has been in place. We have adjusted. We have been flexible in terms of adjusting for the better, adjusting our system, our approach for the better. And combined in parallel with the active case finding case missions that we have that started last week. The accelerated one started last week, and it will continue until the next 2 to 3 weeks. So all of this in combination is part of our measures, part of our sincere efforts to contain and continue to contain and control and fight off COVID to the very end. So please be one with us. Please abide by all the measures. Please understand what we're going through, because we're all going through this together as one society. Thank you for both Thai nationals, our foreign friends, and those who are viewing and following up the different kind of information and different measures on a weekly basis. Those who are viewing this broadcast on social media and from other places from around the world. So thank you very much for your attention. This is what I have for today, and we'll see you again tomorrow. Sawadee krap.